Now, hairstyling is something that is very much in vogue, and patients use wax, gel, undergo straightening, smoothing, curling, perming, coloring. There are various things that are done to improve the aesthetic appearance of your hair. So, we need to know whether can styling damage our hair and increase hair fall. So, to understand that, one should understand how exactly is a hair strand and what is it made of. A hair strand is basically made up of millions of hair cells which are coated over each other, and they are bound together by disulfide bonds. Now, whenever you apply wax, gel, you basically change the direction of your hair. So there is a shearing force that you put on the hair and put it in a different direction compared to how it is normally made. So that shearing force on the hair tends to, over time, weaken the disulfide bonds, which can damage the hair and cause roughness or increase hair fall. Now, patients who have undergone straightening or smoothing, they would have noticed how the procedure is. First, the bonds on the hair cells are broken, then the hair are aligned in a particular direction, and then those bonds are formed again. Now, when this is done, the newly created disulfide bonds will never be as strong as the original disulfide bonds when the hair were originally made and the cells were originally placed with each other. So because of this, it can also lead to roughness of hair and increase in hair fall. But not every patient who undergoes this procedure experiences this problem. So that's because each patient's hair, the thickness, the direction, the strand disulfide bonding between the cells depends and varies from patient to patient. So that is why some patients who inherently have thinner hair or weaker hair for that matter would experience these symptoms after the cosmetic procedures more commonly compared to others. Also, people who wear and use wax or gels on a regular basis, they should keep the exposure to a minimum time if possible. So you can use it before going to a function or for some temporary amount of time, and once its use is done, you can just clean your hair with water so that this excess gel is cleaned off and the damage to the hair can be minimized. So one should be careful when undergoing these procedures, and they should be aware that there can be a possibility of it having negative repercussions. I hope you'll be more informed when you subject your hair to these cosmetic procedures. Does shampooing increase hair fall? Now, to talk about this, we should understand that the job of a shampoo is to have a cleansing action. Its purpose when we apply a shampoo is to clean the dirt, grease that is present on the hair shaft as well as the skin surface. Now, your scalp has, on an average, hair ranging from 100,000 to 150,000 hair over the entire scalp. And out of that 1.5 lakhs of hair, there are 90% of hair that are in the active growing stage, and there are 10% of hair which are passing through the resting or the shedding phase. So even on a normal cycle, normal duration, there would be some amount of hair that every person is bound to shed on a day-to-day basis. So when you shampoo your hair, the hair which are going through this cycle are shed off because of the weakened support. Now, if a patient was to wash their hair once in 7 days, so the hair that had grown weak and are weakly attached at the skin surface would all fall together. However, if they wash their hair 3 times a week, so because of alternate day, whatever hair were bound to shed would come off. So patients often refrain from washing their hair on a regular basis, and they wash it once a week hoping that if they're washing their hair less, they would fall less. So it really does not work that way. If the hair support has weakened, it has lost its attachment, it would come off whether you wash it today or after 2 days. So the regular shampooing does not really affect the hair cycle. But apart from that, certain shampoos which have a more stronger action, a more heavier cleansing effect, so that can have a damaging effect on the hair shaft. The hair cells which are bound together by disulfide bonds, they may be weakened or damaged, which can damage and affect the integrity of the hair shaft, which can lead to hair fall. So in certain patients, they may experience an increase in hair fall with certain shampoos. Now, anti-dandruff shampoos tend to be a bit more harsh compared to the regular shampoos. But if a patient has inflammation, dandruff active on the scalp, then that would be needed for the skin surface of the scalp. And for the hair, they can use a milder one if required. So a shampoo can have an impact on hair fall, but it depends on what is the chemical ingredient, how harsh is it, how well does it suit your hair and your scalp. These things have a role to play to decide how much impact a shampoo will have on increasing hair fall. Thank you.